So, the nocturnal enuresis definition is given by International Children Continence Society, and that is backed up by the DSM-5 criteria and ICD criteria. Number 1, when you should think of nocturnal enuresis is when the child completes 5 years of age. Okay, so you are going to label a child with nocturnal enuresis if the child has completed 5 years, right? Number 1. Number 2, you should ask for the history. Okay, the history should have intermittent incontinence, at least like every month should have at least one episode. Okay, at least one episode, or more than that it should have at least for 3 months. So 3 episodes in 3 months in a child more than 5 years of completed age during sleep. That is nocturnal enuresis, isn't it? So in the definition, you have to involve these salient points. Number 1 is a child whose age is above 5 years of age. Number 1. 2. There is an intermittent incontinence during sleep. How that intermittent incontinence looks like? 1 episode at least 1 month for a period of 3 months. Okay, so all these are satisfied. Then you can label the child as having nocturnal enuresis. Now we will further on divide nocturnal enuresis as primary and secondary, or monosymptomatic and non-monosymptomatic. Okay, so further we will start our discussion. So far you should be thorough with the definition. So incidence of nocturnal enuresis is quite common. 15 to 20% of the children that we see in our OPD actually have nocturnal enuresis. Some of them do come up with the history, but many a times it is surprising. Only when we ask, the parents say, yes doctor, now and then my child will pass urine, or my child will have this bedwetting issue. So please make a habit to ask history of nocturnal enuresis in children more than 5 years of age. That is one. Most of them are boys. See, look at the incidence. It is 60% of them are boys. That is very, very important. Next, around 50% will have a positive family history. So when you get a child with nocturnal enuresis, ask for the family history from the parents also. They might not remember, yes, but if they can ask their parents, they will definitely come up with this history, because nocturnal enuresis is also inherited in a particular chromosome 12 and chromosome 13. There are 2 genes involved, Enure1 and Enure2. I will be discussing about it. So that is why if you get a case of nocturnal enuresis, ask for the family history, right? 50%, half of the patients will have this positive family history. And ask for the daytime voiding routine. How is the daytime voiding? Is there incontinence during daytime also? Only 20% will have, but this symptom, that is history of daytime incontinence, will give you so much significance that it is not just NE that you are dealing with, but it can be more. It can be some other, it can involve a lower urinary tract pathology, or there can be a bowel bladder dysfunction. So this daytime incontinence history is very, very important. So what the parents usually ask us, doctor, will it resolve by itself or not? Should we take any treatment for it? So this is what they ask, isn't it? And many a times parents think or assume that as the child ages, the enuresis issue is going to spontaneously resolve. But what you have to say is, only 15% will have spontaneous resolution. You don't do a behavioral modification, you have not started on any medical management, only 15% will have spontaneous resolution. So more than 5 years, you get a child with NE, start with the periodical follow-up, do the management as we are going to explain now in this presentation. Remember the percentage, only 15% will have